Located right in here are the calyxes. There's a major calyx and a minor calyx. And a calyx is a cup-like division that's found in the renal medulla, and the minor calyces drains into the major calyces. This indentation right here is the hilus. It's a little depression where the renal artery, renal vein, and then the ureter enter and exit into the kidney. The superior vessel is the renal artery, which is a branch of the abdominal aorta, and it supplies the kidney with oxygenated blood. The vessel that's just superior to the renal artery is the renal vein, which carries blood out of the kidney, and this blood is filtered and deoxygenated. Towards the outside of the curve of the kidney is the renal capsule, which is dense, irregular connective tissue layer, and its function is basically protect the kidney and keep its shape. And then the outer region of the kidney is just called the renal cortex. Here is the renal lobe, which consists of the pyramid, which is the portion of the cortex at the pyramid base, the portion at the adjacent renal column. The renal medulla would be located more in here because it is basically the inner portion of the kidney. The renal papilla is about right here, and it is considered the apex of the renal pyramid, and it's just continuous with the minor calyces, which, if you recall, is drained into the major calyces. This large cavity right here is the renal pelvis, and it receives urine from the major calyces, and it is continuous with the ureter. The renal period, which I mentioned before, is just a repeating cone-shaped structural unit, and it's found in the medulla, so the inner portion of the kidney, and its base is facing the cortex, and the apex is facing the hilus. And then lastly, the ureter, it's the vessel that's right below the renal vein. So it goes renal artery, renal vein, and then the ureter, and it's just a tube that connects the kidney to the urinary bladder.